I'm Richard Kennedy, and I'm the National Bloodborne Virus and Programs Lead at AIVL, and I'm speaking to you from the heart of the home of the Gadigal people of the Eora Nation. Now, the Hawkesbury River bounds the Gadigal land to the north, the Nepean River to the west, St George's River to the south, and the ocean. Sovereignty was never ceded. This is Aboriginal land, always was, and always will be. I pay my respects to all Aboriginal people on the panel and who are watching us today, and I'm proud to call myself an ally. Now, just to let you know, this webinar is being recorded, and only the panel's faces and the audio is in the recording. And if you want to, you can turn on the closed captions using the little button on the bottom of the screen. I think it's the first on the right. And also, we're encouraging any questions and comments you might like to make. So please put those into the Q&A box, and we'll try and answer them as much as possible. AIVL acknowledges the legacy of the peers who went before us and those who continue to strive for equity and social justice in the face of criminalisation. We reaffirm our commitment to the work alongside our community of people who use drugs. We challenge stigma and discrimination in all their manifestations. And so I suppose that's a good segue in today's webinar discussion. Peers to the front, the critical role of peer leadership in Australia's hepatitis C response. Now, I'm going to introduce my amazing panel, and just so there's no favourites, I'm going to do it in alphabetical order. So, if you could each give us a bit of a brief introduction and discuss the role of peer leadership and how we see ourselves in these roles. So, I'll first of all pass over to Aisha, who's in Queensland.
Thank you, Richard. So my name's Ish Layden. I'm a peer harm reduction coordinator at Quinn in Queensland Injectors Health Network, and also a board member for, I'm also on the AIVL board as well. I've been in in the drug sector for probably the past 8 years, and I've been a member of the drug using community for the past 34 years. I've got lived experience of Hep C and treatment, also the justice and custodial settings as well. And in my role at Quinn, I go out and test and treat people for Hep C and support them through treatment. There you go.
Thank you, Aisha. And is it cold up in Queensland today?
Look, for Queensland, it is cold. Everyone's wearing a jumper, but yeah, not as cold as like some other states. So I won't go on about how cold it is in Queensland at the moment.
So
Because really,
I
I
think
need to
someone who's
harden up,
probably
I think. Yeah.
I think someone who's probably feeling a bit colder at the moment would be Joe, because Joe's in at Launceston in Tasmania. So welcome, Joe.
Hi, thanks for having me. So yeah, my name's Jo Murphy, and I'm in Kanamaloka, which is home of the I'm sorry, I've never used this word before, and I just asked someone how it's pronounced, and I'm stumbling with it. The Litaramiran people. Apologies for any mispronunciations. I have worked in harm reduction for 15 years or so, mostly through NSPs. I'm also on the board of directors of the Tasmanian Users Health and Support League, which is peer-led Tasmanian drug user organisation, and I have the position of chair. And I'm also working at AIVL as one of the co-coordinators for the National It's Your Right campaign. It's the second round of It's Your Right, which was highly successful the first round of 3 years ago. So we're really excited about the opportunity to run this campaign again. It's peer-led, and will be run through each drug user organisation in each state and territory across Australia. So.
Thanks, Joe. That's excellent news about the It's Your Right campaign. I remember when we were running it last time that Rod was running it through the US. So yeah, pretty excited about that. And our next panelist is Joelle. So Joelle's talking to us, I think, from Albury. And
Yes, that's
Joel's a
right.
community
Yeah.
member.
I'm on Wiradjuri country. Yeah, so my name's Joel. Use they them pronouns. I'm non-binary and I'm a queer person. Been working in harm reduction for about a decade now. I've managed needle and syringe programs and services for people who engage in sexualized drug use, as well as like I've been at the injecting center and I was treasurer of Harm Reduction Victoria for a while. So yeah, more recently I've been doing some research in with people who use and inject drugs internationally, and that's been yeah, interesting to hear what the differences are between other jurisdictions and how it is here in Australia. So yeah, happy to be a part of the panel.
Thank you so much for joining us. It's really lovely to see you again. It's been a while. And our last panelist is Rod. Rod from Sydney. And Rod and I worked together for quite a long time, so we go back quite a way. So, Rod, if you'd like to introduce yourself, you're on mute. Rod, you're on mute. Rod, you're on mute. We can't hear you.
There we go.
There we
Someone
go.
put
Thank you.
I can do it, people. Sorry, it's not my fault. I'm still hiding behind that. Anyway, hi, my name's Rod. Welcome. I work at Newer. I've been in the harm reduction space for. I started volunteering at Newer in 2012. I now hold a couple of roles within the organisation. Basically, all revolving around hepatitis C. I'm the coordinator for the Power Project, which is Peers on Wheels. We have a mobile van and we take it to more regional areas of state to test. We're off tomorrow to Newcastle for Hunter Homeless Connect on Wednesday, so taking a team to that. I also am proud to be the team leader of the Aboriginal team of peers based at Nepean Hospital at Extension Parker, and we go and do harm reduction talks and that sort of stuff as well. So we look at trying to meet people where they are, and that can be if they're injecting still actively, then we make sure that they're doing it properly, clean equipment, that sort of stuff. If they're in the health phase, we talk about hepatitis C or getting to GP appointments rather than blood-borne viruses. And then if they're looking to change their life around, we would hook them into other partners. So that's my role. I look at trying to get people to the service they need to see when they need to see it. Yeah. Thank you.
Thank you. Thanks, Rod. And I would like to say, Rod has a respect of the entire community. Anything that comes along, Rod puts 150% into his work. He is so passionate and works so hard. It's a real honor to have you on the panel today, Rod. Thank you for joining us.
Thanks, Richard.
So, a couple of questions. I'll throw to one person, then we can just toss it around between us. Um, but I think I will start this one with Joe because you're going to be doing the HLI. What advice would you give to someone who's hesitant to get tested or to start treatment?
Obviously, you never want to pressure someone into something they're not ready to do, but I guess I would remind them about the treatment these days that I went through the interferon treatment, and I have very vivid memories of the side effects, etc., and being on the waiting list for 5 years, and all of that. So I would remind them that they don't need to stop their drug use if that's something that's that's a barrier for them. There's minimal to no side effects that if there are any, they usually clear up, within a month or so of the treatment. And just how amazing it feels to clear Hep C. Like you don't realize like how much it's affecting your general health because it is quite subtle at first. I mean, some people feel very fluey and stuff before, and then it clears up. So it's not until your liver's struggling that you really your energy starts to drop, and yeah, you just generally don't feel great, basically. But as soon as you clear it, it's like you've been wearing concrete boots for the last, I was living with it for 10 years, and yeah, the difference was amazing. Yeah. And just not having to worry about passing it to someone else or having those conversations of, do I have to tell this person or that person, etc. So, yeah.
Thanks, Joe. The reason I asked you this question, because I remember you and I were having a casual chat about it the other day, and I was lucky enough, I didn't start treatment until the antiretrovirals came in, which was like 2017. But you're definitely right, because with hepatitis C, it creeps up on you. You actually don't really notice the side effects you're having of it.
Mm.
You just start to feel a bit tired and a bit lethargic, and you put it down to lots of other lifestyle factors. And it's not until you actually start taking the treatment that actually the brain fog starts to disappear and you start to have more energy and you really start to feel like you're getting your life back. However, I must admit for myself, when I first got the script and I had the pills and I had them sitting on my nightstand for about a week, and I was very hesitant to take them because I was really worried about having the side effects. And I was making all these excuses like, oh, maybe I'll wait until Monday because we're going to a friend's barbecue lunch on Sunday and I don't want to feel sick. But yeah, definitely, once you start taking them, that you really notice the difference. Do any other
Yeah.
person on the panel have
Oh,
anything to add to this?
I just wanted to like, sorry, I'll let someone else speak, but I just wanted
No, no, no.
to add, like, yeah, that there's still a lot of perception in the community that the treatment is really hard because it had such an impact on people's lives when before the antiretrovirals. So it stuck around, and getting that message out there that, I mean, you went through the very early pills, so you know you were taking on pioneering a new treatment as well, which I'm sure would I know for myself that would have played into, you know, there
Yeah,
wasn't a lot of information about it. I mean, there was, but not from here. So yeah.
yeah. Does anyone else have any comments about taking the treatment or?
I
Nope.
think that all I've got to say is that it's really easy. All you need to do is take one tablet once a day for 12 weeks, or three tablets once a day for 8 weeks. Like, it's
Mhm,
really simple. Probably the only hardest thing is just to remember to take the tablets every day if you don't take any other medication, which,
mhm,
we can set reminders or put it in your phone, but that's probably the hardest thing is
Mm.
just to remember to take those tablets every day. So yeah, it's really easy.
And having gone through the process myself, I did have Epclusa. Um, I tell clients when they're doing to have their tablets with something they have every day. If they first get up in the mornings and they have a cup of coffee, that's when they have their pill. Or if they only eat dinner at night, that's when they have their pill. So that rotation happens. Particularly at the beginning of it, we need them to have a consistent intake of the medicine to help
mhm.
beat the virus. So that consistency is really important to do. But when you talk to them, and we talk to someone new, I tell them about my experience, what I did, and that's stuff like that, that first cup of coffee in the morning or whatever. And I think people appreciate that. And they also appreciate the fact that in my case, the only thing I didn't have, sorry, the only side effect I did have, if anyone knows we produce something called Users News, a magazine, goes out. Yep. So my story was done in that by Leah, and in there we did 17,000 copies of the fact that my stools weren't quite firm enough. So I have no sense of other than total embarrassment on that one. But that was the worst thing that happened, and it was I can laugh about it and I can say that, and people appreciate then. This isn't going to be a difficult thing. It's going to be a great thing. And I agree with Richard. I just thought I was getting old. I didn't find out about it until I was in my late, I'd say mid-50s. Anyway, and I just thought I was getting old. It was getting harder to put your feet on the floor in the mornings. And then all of
Yeah,
a sudden, someone through it, a light switch goes off, and you feel like you've just got so much more energy.
yeah,
It
you
is,
really
yeah,
feel
I
like it's
heard, oh, sorry,
sorry, yeah,
Richard.
you feel like you're getting your life back. The brain fog clearing and the energy and the way you just start to connect with people, it just makes such a big difference. Joel, how about you?
Yeah, I mean, for me, like Joe, I echo what Joe said about like having experienced the old treatments. They were like shocking, shocking. Like it was one of the worst 6 months of my life in terms of just like, yeah, having how to deal with it and the physical and the mental health struggles. Um, and yeah, and I felt like the treatment let me down as well, the first treatment, because it wasn't successful for me. And so it kind of felt like I'd gone through all of this, like this really hard experience, all for naught. Um, I'm was living with HIV already, and when I got my Hep C diagnosis, And I think some of the like internalized stigma was really like affecting me. I feel like like I was just kind of coming to terms with living with one bloodborne virus, and then I got this unexpected news of a second bloodborne virus. And so yeah, like Joe said, I like was really worried about like who do I have to tell, and like I don't want to pass it on to anyone else. And so I think after taking the new treatments, just like having one less bloodborne virus in my system, like sharing my body with me was a really wonderful thing. Like it was a bit more at the spiritual level, I guess, or the metaphysical level, just feeling like, yeah, with this one less thing that's host in my body, and that was a really good feeling.
Yeah, I can
Yeah.
totally relate to that. I think I know for me that was the best thing that for clearing treatment. I'd gotten rid of this thing that had so much stigma around it, and I'd internalized that like very deeply. So yeah, every time I remembered, I didn't have to worry. It was like finding out that I cleared it all over again. It was it's hard to sort of verbalize how much of an effect that a positive effect that had on me.
I agree with you, and I agree with Joel so much because I'm also living with HIV. So when you're living with HIV and you have hepatitis C, not only is the amount of stigma and discrimination you get leveled at you
Mm.
the whole time, you actually worry about what's going to happen inside your body because your body is already with the antiretrovirals fighting HIV, and then your liver's getting a double hammering with the hepatitis C as well. And yeah, it can be really quite worrying, as you said, who you tell what effect it has to do with your body. But it does make you a bit enclosed because you are worried about the stigma and discrimination for having two bloodborne viruses, especially for those of us who inject drugs. So I was just wondering,
Mm.
actually, I'm going to go back to you on this one, Joel. So what role do peer leaders play in reducing stigma and misinformation, I suppose, in our affected communities?
Yeah, thanks. That's a really good question. And, I've talked a little bit about how I got, my circumstances with Hep C, but I think like it caught me by surprise at the time. And there was like a whole cluster of people living with HIV in Melbourne and Sydney who got Hep C all around the same time. Um, and so, like, we knew that there were people living with HIV already in the community with Hep C, but because it was what they call the silent years in the HIV response, people weren't really able to talk about like their drug use or particularly injecting drug use because it was so stigmatized. Um, uh, and there was political pressure at the same time on community organizations to not necessarily be talking harm reduction. And I'm talking not about the harm reduction organizations here. I'm talking about like the HIV organizations and the organizations for people living with HIV. It was a complex political environment. So the best thing we could do was to like get out and talk, really. I was encouraged by a friend to go on a podcast or a radio program that was scheduled much later at night, and so we could talk more frankly about sexual adventurism and the risks for Hep C and how we could reduce our harm. But we were also talking about the sexual transmission risk for people living with HIV, which was completely new information at the time. And so um, often, by putting myself out in the public and sharing my story, I would have community members come up to me to not necessarily like come out and disclose their Hep C status, but like to invite me into like a conversation about their Hep C status. And so maybe someone more wanted to just share that they were like about to start treatment or they were thinking about treatment. Or maybe they came to me to say, I finished treatment a week ago and I feel wonderful, and so there were those little moments that were really informal when you put yourself out there with your story that community members can connect and feel like safe and can trust. So I think that's kind of those moments where that leadership is like, it's really rewarding in a way. But it's really kind of critical that those people feel like they can come and get the information and not be discriminated against. And yeah.
Oh, thanks, John. And X, how do you feel about that? How do you feel about peer leaders? How do we reduce misinformation in affected communities?
Sorry, are you talking to me, Richard?
Yeah, I was
Oh,
just wondering, yeah,
sorry.
how do you,
I couldn't hear
yeah,
you. Cut
it's
out
all
again.
right.
I feel that as peer leaders, we've like play a really, really important role, especially in our work. So we just talk about Hep C very freely now and ask people if they get tested and tell them about treatment. Like there's no stigma, like just talk like saying, hi, how are you? Like to because there's so much stigma around Hep C, to try and lift the stigma that people have living with Hep C, like to make it much more of a freer conversation to have with people. Um, and also, like I've done a lot of lived experience talks in conferences and webinars and stuff. And I feel as a person that's lived with Hep C and done treatment, it's good for um, everyone to know, especially all the researchers and professors and people that are working in this field, because a lot of them haven't lived with the virus. So actually telling them what the virus is like and what the treatment is like from a person's lived experience is huge. Um, and also, I feel that doing that will stop the stigma that people think regarding people living with Hep C, and especially people who injecting drug users as well. So being open and saying, listen, I'm still a person who injects drugs and I've lived with Hep C and done treatment. I don't get a shock from many people anymore when I used to, but doing these living experience talks. And it's good because like all the researchers and professors that do a lot of research and write books and resources on Hep C and treatment, it's good that they can come now to us peers and ask for our advice and go, hey, is this worded properly, or what do you think of this? So they get the peer knowledge as well instead of just their knowledge, I suppose. Yeah.
And how about you, Rod? How do you feel on that subject, about being a peer and um, reducing stigma and misinformation at all levels?
It's really important that every time we see something that's not correct, even by the slightest amount, we have to correct it and do it in a way that we don't put the person down. It's an educational chat. I had one lady who said she couldn't possibly have hepatitis C because she hadn't had A or B yet. So that's quite funny from to listen to that from our perspective. But in her mind, she couldn't possibly have it because this is the order these things were done in. So people think of things very differently, and that sort of stuff. But then to gently tell her that no, they're separate diseases, and they may all be called something similar. They're very different, and it's stuff like that. And I think the other thing is too, we still have one of the clinics we did recently. People still think that they can get Hep C other ways other than blood, more like a Hep B or a HIV infection, those sorts of things. So clarifying how it can happen, being descriptive about that possible scenarios, which aren't injecting drugs. I mean, it can be contracted other ways. Unfortunately, domestic violence is on the rise, and been some interesting stuff showing that in those cases where skin is broken, there's been an infection. So just trying to make sure that the information out there to everybody we can is correct, even if it's slightly wrong, fix it so that hopefully that person will have a conversation with somebody else, and they'll just, by that sort of thing. Yeah.
Yeah, I think that's a really good answer, actually, because not everyone gets hepatitis C because we're intravenous drug user. There are other ways you can get hepatitis C. But if you do have hepatitis C, you're automatically branded as an injecting drug user. And so we have to make people a lot more aware. Now, Joe, I was just wondering, living in Tasmania, do you experience a lot more stigma and discrimination there because you're from a much smaller community and probably a bit more of a liberal community than us on the mainland?
I mean, that would make sense. Yeah, I haven't lived in another area in Australia to have my own personal experience with comparisons, but absolutely have experienced just ridiculous amounts of stigma when it's come to hepatitis C. Like health workers, probably the worst. I mean, and I've always been very upfront about my status, and that was one of the great things about clearing was I didn't have to go through the stigma every time because and I knew what was coming, like you can see like if there's an instant physical change in people, and all of a sudden there are different protocols that people use, and it's like we always shouldn't you be using shouldn't there be a standard for everyone? Like there's people who live with bloodborne viruses that don't know they have them. There are people who live with Hep C and don't feel comfortable disclosing to to a health practitioner or anyone kind of thing. And it's always that assumption that you don't care about your health if you still have the virus as well. Yeah, and it's very heavy still, that stigma. Like, yeah.
Very much so, yeah.
Yeah.
And I think, as Joelle and I will agree with you when you have HIV as well, there's a lot of stigma. And someone's just put a comment in here and they said, constantly hear misconceptions about hepatitis C. People think they can give it to them. So, where I work, I wonder if you have any advice on how to debunk some of these myths. So, anybody want to go for that one?
That's actually a common one I used to hear at the end through the NSPs a lot as well. It's I don't know how it got started that people can give themselves the virus. I think it's good to remind people that once you clear hepatitis C, you can actually get the virus again. Um, like that's another misconception that once you've had hepatitis C, then you're immune to it. But yeah, I think it's just about starting those conversations and just telling people what is actually a myth and what isn't, and explaining it as well, sort of breaking it down. Like with that specific one, explaining that, well, the virus has to exist for you to contract it. It doesn't just sort of grow out of nowhere. So it has to enter your body before. So if you sort of break something down and into logic, it becomes pretty clear that, it can clear up a lot of myths really, really quickly, I think. But yeah, it's about having those conversations really too.
Does anyone else have anything to add to
Yeah,
that one?
I think that myth's like very, very common, especially in the NSP and with my like even with my community, about catching it yourself. And I'm just like, how the heavens could you catch it yourself? Like, just have a think about it. Like, okay, so you've used a syringe once and you don't have another one, so you use it again. Do you have Hep C at the time? No. Well, how could you give yourself Hep C if you don't have Hep C? Like, you can't give it to yourself. So, and they're like, oh, yeah, that's right. Like, just putting it into logic is just, and they're like, oh, I can't even believe I was saying that, you know? But yeah, I think it's just been a myth that's gone around for many, many years. Like, I've heard it when I started using 35 years ago. So I suppose it's just a lot of people, the older people in like the drug using community have got a lot of these myths that I just think, where the heavens do these come from? I'd love to know exactly where these started because it would be quite interesting. But just to explain it to them like correctly and try and put a stop to the myths is quite difficult sometimes when they're just so stuck in their ways. But yeah, just making it logical, I suppose.
Yeah, and
And
I
there's
think a
so
lot.
much.
So, yeah, I think a lot of people think it is just from sharing needles or use needles, whereas they don't realize there can be other injecting equipment as well, such as tourniquets, sharing spoons, and things like that. And as Rod alluded to earlier, things like domestic violence, things like that. Do you have anything to add, Rod?
I was just going to say, sometimes you've got to take it out of the hepatitis space and put it into something absolutely ridiculous. for people to realize how silly it sounds. Because we have A, B, and C, at least with the hepatitis family, people get confused as which is which. But if you take it out of that space and say, hey, look, can you make yourself pregnant? You know, and they just look at you blankly. But you know, you can't. So you can't give yourself a disease unless you had it in the first place. And then you've got it already. So sometimes it's much easier to take it out of that space and talk about chickenpox or, you know, that sort of stuff, and try and describe the in a different disease, so it's the only one that sort of stands alone, and that might confuse some people, but it kind of works for me. But I have used the can you make yourself pregnant before, and you know, and they understood then, as she said, it was just so ridiculous. You just have to make sense of it. But I think the other thing too is, again, good information. If someone was trying to debunk something, make sure that they maybe have something written from one of our organisations to show the person, stuff like that. Because will I take any notice of a co-worker and we work in a warehouse? I don't know. But if I had a piece of paper that came from AIVL or from Reduction Victoria or whoever, or newer, maybe I would. Maybe I'd look and take some information from it.
Okay, and I've got actually a couple of comments here from Tegan, and it says the myths around giving it to yourself, I believe, started in the correctional settings from prison officers and using the EWSE principle for education helps that, which is what Esha was talking about. Now, I know Esha and Joe, you both do work in correctional settings. Do you have any comments about hepatitis C in the correctional settings?
I mean, my biggest thing is I don't think it's going to. I mean, and I mean, people need to have access to sterile new equipment. Basically, like there needs to be a more open and just people they just need to face the fact that it's going to be impossible to clear when it's being when people are forced to reuse equipment. Yeah. I mean, to me, that it's not black and white, obviously, but it's a pretty simple argument. You can't get a stronger argument for introducing NSPs or not necessarily NSPs, but some form of sterile equipment into settings like jails, like prisons.
I
Or do you
also
have some?
think
Sorry, Esha.
it's a good in Queensland we're doing these point of care Hep C blitzes in all the correctional centres. So a team goes in and tests like nearly every prisoner. So the prisoners don't feel like they need to stand up and make themselves like noticeable to go and get tested. So that they do block at a time. So no one's, putting themselves out saying, hey, I need to get tested, which I think is a really good thing because, these days a lot of people don't want anyone else to know that they want to go and get tested for Hep C or something. So if they're doing it in blocks, it's good. I know they've got a pretty massive success rate doing the blitzes and goes for a week or even a week and a half sometimes. So maybe they need to start that in every state. I think it would be good.
Yeah, I
And
mean, some state territories don't have point of care testing yet, even like inside and outside prisons. So I think, and I mean, going into the prison and increasing knowledge, general knowledge on harm reduction. It's such an insular community. Like peer education is so vital in a place like the prisons. I mean, and so they need to be more open to having people go in and have those discussions with people who are there. Yeah.
I
Similarly,
think
like I would
that's
hear
so.
people using the injecting service, the supervised injecting service in Sydney would talk, who've just been released, would talk about not, deciding not to do treatment while they were in a closed setting because they couldn't control whether or not they were going to get reinfected from what they were doing in prison. And so, there are people also making choices to wait until they're out on the outside to do their treatment, which it's just something else to consider in the mix. That's what's happening. for people in New South Wales, some people in New South Wales.
Yeah, we have that as well in Queensland. A lot of people that, come to our service wanting support and stuff. And I go, do you want to get tested for Hep C? Yeah, we'll get tested. And if it comes back positive, do you want to start treatment? No, there's no point in me starting treatment because I'm just going to be in and out of jail. So there's no point. And I'm like, well, there is. Like, come on, it's only a tablet once a day. Let's just get you on it. You'll feel much better. And you mightn't catch it again if you go back to prison. But you would have been cleared of the virus, you feel better, and then you can tell everyone else about it. So a lot of my clients have decided to do the treatment and come back out of jail and still not had the virus. So which is a bonus. Okay? So it's put their theory to rest.
Yeah, thanks.
Okay, I've just had a really interesting question here from B, who said they've supported people to get tested, and the GP hasn't explained things well or offered the treatment options when there's a positive result. And some people have worked well, but is there a way that peers can actually educate educate GPs? What would you think about that? And how will we be able to educate GPs about explaining about treatments and the options?
I think that's a massive thing that we should educate GPs. I've done quite a few lived experiences for ASHM, and I've done 2 with doctors, and it was amazing how many doctors decide to ask questions in the end. And I was thinking, like, one was, for example, if I have a family that all live together, like say there's 10 people in the house and one of those people have got Hep C, should the whole family get tested? And I was like, I'm just a peer, not a doctor. I haven't gone to university. Like, shouldn't you know that answer? Unless they're sharing like, I don't know, tweezers, like sharing blood to blood. I don't know what type of family it is, but not really. Not the whole family shouldn't have to get tested. But yeah, it was good to talk to the doctors because they were asking really good questions, which to myself, I thought, shouldn't you already know this? They were just basic questions. Can't even think of anything else off the top of my head. But if they're willing to listen and learn, it's marvelous. I think we should.
That's like going back to an earlier question that you asked me, Richard, about living in a smaller, more sort of very conservative area. The doctors don't like having people come and try and teach them about the newer treatments, and there's still a lot of doctors here, like even methadone and OAT prescribers who will put people through unnecessary scans and delay their treatment, for months and in some cases years, right? Because they're not informed and they're not up to date with the latest treatment, but they're also not open to having a hepatitis C nurse come and talk to them and take them through the latest treatments either. So yeah, that's been quite a big issue here.
I think that with the doctors and the GPs, they aren't specialists in this area, and they will often send the client to have an antibody test done. And even though we know they're going to have positive antibodies, because the client says to the doctor, I've had hepatitis C before. Well, they send them off and do an antibody test anyway, which comes back as being positive, of course. And the client goes into a bit of a tailspin because they cleared it, and now the doctor's telling them they've got it again, and it's because the doctor hasn't ordered the right test. That's quite common. And I think that, we need to approach the doctors with some air of authority in what we are expecting. I'm not going to tell them how to write a script. There's a very clear line between what I do and a clinician. But if they're spruiking something that isn't right about Hep C, then I should stand my ground and say, hey, look, that's not right. This is what happens with that. And they either will take that on board or not. And as Joe said, they will delay doing things like that. We've seen there was a case in one of the clinics we did where the GP did delay and seemingly unnecessarily to do other things. But it's quite complex in that. But my experience with most of the doctors we deal with, because we get a positive result on our POCT machine, we do a referral to the doctor or health service that the client wants, and then I'll get a phone call from the doctor from that GP service who hasn't treated another person with Hep C ever sometimes, and they'll go through the whole process, and they're willing to talk and listen to you because they've got a client in front of them who's recommended them or wants them. So I think it's good, but we need to be a professional and basically make sure we stand our ground where we know we're right on something, with respect to let the doctor know that they've done. There's a better way. That's probably a better way of putting it.
That's
And
we didn't. Sorry.
I was just going to ask Joelle, have you found a sort of a lack of understanding amongst GPs, both with HIV and hepatitis C? And
I'm not so bad with my experience with GPs, touch wood, but certainly my like HIV specialist or like the registrar or whoever's been kind of assigned to me, because usually it's a more junior doctor seeing me before my actual doctor comes in for the last bit to check everything's right. And things like, like I've so many times I've been offered a Hep C test, even though I say I have not injected drugs with anyone else. Like if I'm going to do that, then I'm doing it on my own. And so it's almost like she's not hearing they're not hearing the fact that is no risk. Like there's zero risk. Like this can't come from nowhere. Like it doesn't. Yeah. So it's like I don't need the Hep C test. I don't need that. That's a kind of to do so knowing that I don't need it would be a waste of healthcare resources. And so I think that sometimes there's those things can get in the way. I know, like for example, I've been billed like because what people were saying earlier, like to find out if I've got a new Hep C infection, I need to have a different type of test than an antibody test. And so I've received bills from pathology labs saying you need to pay for this because we've got no record of you having done done an antibody test. And it's like, well, that would be a waste of healthcare resources again. And so, yeah, it can be a bit tricky when you get caught. I would say when you're getting caught in systems, because what these are really just systems issues in some regards.
thank you. And
I
actually, I've
think
just had a very nice comment from you, Esha from Adrian, saying, never call yourself just a peer. Peer knowledge and experience is vital. Okay, so I've got another interesting question here. This one's coming from Melanie. So can you just tell us a bit more about harm reduction initiatives that peer-based services are implementing in custodial settings, and also work focusing on people returning from the community post-release, because there's a lot of work to be done in this space. So um, do you want to go with that one, Ash, first of all?
Yeah, I'll go with that one. So at Quinn, we have a prison transition worker who works in the prisons and out of the prisons. So if someone has started treatment inside and gets released, they will get will follow up with the clients that have been released to see if they've got their medication and to make sure they're taking it. If they haven't got their medication, they will pick medication up from the prison and then drop it off to them at home and support them through the treatment, and then get them to come in and get tested after treatment. And same with inside. If someone started treatment inside on the outside and they gets put inside, she will follow them up and make sure that they've continued their treatment inside as well, instead of going through all the tests and blah 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 when they get locked up. But she also goes and visits most of the prisons and does some education with the inmates. So does some like harm reduction education while she's in there, and follows up with them if they're, being tested. If they've like wanted to be tested and they haven't yet while they're inside, she'll make sure that she contacts the bloodborne virus nurses to come and get them tested, and why haven't they started treatment, etc. And she also goes all the blitzes, the Hep C point of care blitzes as well, which I think, look, it helps as well. Like as soon as some of the inmates have been released, and they'll call her and go, "Oh, I need my box of meds," and she'll go, "Who are you?" And she'll go, "Oh, remember me from Woodford," or something like that. And she's just that connection from inside to outside and outside to back into inside, just having that one person,
Yeah.
which I think is great.
As somebody just asked, could you explain what you mean by saying a blitz?
Oh, sorry. So what they do is they take in like 4 or 5 gene expert point of care machines, and
Mhm.
they test like the whole prison, so every inmate in the prison. So maybe there's 700 inmates. They'll be in there for like a week or week and a half, testing every single inmate to see if they've got Hep C or not. So if they've come back positive, they make sure they get scripted, and they'll probably start their medication within probably a week, week and a half. Yeah, and if they're not positive, well, they're fine. But this time they've given them the little Mars bars, which has been a great incentive because they all love a Mars bar. So, even if they've been tested before, they'll want to get tested again just to get the Mars bar. So just little like incentives like that mean a lot.
I believe Joe was told off for taking too much chocolates and sugar into custodial settings.
Yes, I was.
Okay, I've got a question. This one I'm going to put to Rod. What's one of the most powerful or memorable moments you've had while supporting someone through testing and treatment?
I was thinking about this question before, and it doesn't have the treatment part in it, but it certainly has the testing part in it. There was a lady in one of our regional areas that we went to who had been living, she thought, with Hep C for approximately 5 years. Very small community she came from, and was a lady of First Nation. And so she couldn't go to the local health services because she felt that everyone would know, and the Bush Telegraph would be in full operation. So she'd lived with it and lived with it and lived with it, and was really upset. She didn't know how she had contracted it, or all those sorts of things, and no one had really worked with her when she first got the diagnosis of it. We went along and we did a power clinic, and she came along. And part of our protocol when we do that is to talk about the risk factor. So whether we would just do an antibody test, or whether we have to do an RNA test, or whatever we do to get there. So she said that she was told she was HIV, sorry, wrong disease, Hep C positive, but had not done treatment. So for that means for us, we have to do an antibody test. We did a first antibody test, and it came up as negative. So she should have shown that she may have cleared it, but she should have shown us a positive result on an antibody test. So we did a second antibody test with a different system. So we used an Insti, and then we used a BioLine, and she came up negative on that as well. Effectively, she'd been misdiagnosed the first time round after a while, and the poor lady had lived with the shame of this for 5 years. And we just took all that away for her, from her, all that away from her life and situation. She was in tears, and I've had to console some people because they had Hep C and they didn't know, and I've spent time with them after I've given them the diagnosis. But I've never had to comfort someone because they didn't have Hep C before, and it was really touching. She was really so appreciative of just being able to have that told to her, and be clear about it, and just to sit with her then and let her sort of vent 5 years of hurt, and stuff like that. So it's not into a treatment setting, but I mean, it was a really one of the things that sticks out in the last 5 years of doing sort of Hep C treatment. Yeah.
Thank you for that. Has anyone else got any sort of memorable moments where you've actually helped somebody through treatment?
Yeah,
A powerful
I've got a
moment.
memorable moment. So I tested this client around about 6 years ago, and came back positive. And I'd ring him to say, do you want to, book him into an appointment to see our nurse practitioner to get scripted? I'd book him in, he wouldn't turn up. So then he would ignore my calls. So I kept him open on my caseload. I'd ring him every few months. He'd ignore my calls or just not answer, and then he'd answer, and I'd book him in, and he wouldn't turn up. Well, 6 years ago, 6 years to the date, I rang him. I said, listen, our nurse practitioner's coming into our Burleigh office. Would you like to come in and make an appointment? He's like, yep, I'll be there. I thought, okay, yeah, we'll see. Well, he turned up early, he was here. He turned up early, so I was like, listen, I'm going to barricade the door so you can't get out of here now. You know, we saw a nurse practitioner, got scripted and started treatment. So after 6 years, I was like going to do cartwheels down the hallway. He's like, go on then. I'm like, no, I just thought, oh, that's how excited I am. I'll do a cheer dance instead, you know. But you know, just being persistent and just calling him every few months, and you know, like he just, you know, he felt embarrassed because he wasn't turning up to the appointment, so that's why he ignored my calls. And I'd see him in the NSP, and you know, eventually he decided to start treatment, and he's nearly finished it now, which is marvelous. So.
Okay, so we're starting to get to the end. I just want to, and I'm going to ask all of you this to answer this question. What does it feel like to be a peer leader, and what does leadership mean to you? So, whoever'd like to take that one first.
I never used to really think of myself in that way, and I still struggle with it a little bit, I guess. But when I realized that I did play an informal leadership role through the NSP, was the advocacy of promoting treatment, I guess, and then people asking my advice so often. But yeah, I mean, it's definitely good to know that you can provide a safe space for people to have conversations that they might even hide from their partners and family and things like that. Like, yeah, it's because that I didn't have that. And so it's really important to me that, I mean, I think it's a basic right, sort of, that people should have that space. Like, so if yeah, just helping to ease that stigma, I guess, a bit is really, really nice. Like,
And Joelle, what does leadership mean to you in this space?
Yeah, I was thinking about this earlier, and like I was also thinking about like those small acts of leadership, like you know, given a friend some spare equipment that you've got, like that.
Yeah.
Doesn't have to be as big as like getting in the public and sitting on a panel or telling your story to the media or on radio or something like that. It can be those like really small acts that might make a very tangible difference to that, you know, in that immediate moment. Yeah, I've been in those situations where I haven't been able to access harm reduction equipment because like a service is not open, or it's too far to get to the 24-hour service. And yeah, and so I really, really appreciate just those small acts of leadership.
That's a great answer. And Rod, how about for you? What
Um,
does being a leader mean to you?
I was really fortunate to learn from some really wonderful people about drugs and things. So when I got out of jail just before I started with Newer, I thought I knew lots about drugs and I thought I knew lots about HIV. And they were the two things. And I wanted to give back to the community. Well, it turns out I knew a reasonable amount about HIV. I knew a lot about ice because that was my drug of choice, but I knew very little about drugs in general. You know what I mean? And I had some really wonderful mentors as far as that goes. For me, being a peer leader, it's about being consistent and being so when someone comes to ask you a question, you know, you've got to keep that level head of talking. You might have 3 or 4 things going on, but this person's asking you a genuine question. You've got to make sure that you give them a good answer that's correct and all those sorts of things, but do it in a way that you don't make them feel silly. All those sorts of things that, you know, good management skills. We need to bring those on as leaders in this field too. And I think we just need to make sure we never remove ourselves from that team, because we were a member of that team. And like me, I had great mentors. Hopefully I'm a mentor to someone that they think that what I tell them is right and is correct. And, you know, they'll come back and ask me another question.
And Ash, how do you feel? What does leadership mean to you?
Geez, I've never classed it as a leadership. I feel that like I'm just myself with all the time. So what you see is what you get. And just being able to have those conversations with clients and, you know, my community, like when they come into work, or even, you know, when I'm not at work, in my private life, with my community, just being myself all the time, not putting on two hats, just wearing the same hat and just being completely honest with them. Like, if I don't know something, I'll say, listen, I don't really know that question. Like, I'll go and find out for you. But yeah, not making it up, because we all know that you can always tell a bullshitter. So, just being brutally honest with people and just being yourself, I guess.
Yeah, I think it's about being authentic, really, isn't it? It
Yeah.
is. I've got one more quick question, and maybe Rod can help on this one. I know some states have great mobile hepatitis C testing services, just Peas on Wheels, but not all states have this scope of this. How are we able to further reach into the rural and remote areas and not leave people hanging there?
I think the two that I know of are POWER in New South Wales and the Combi Clinic in Queensland. And the Combi Clinic has clinicians attached to theirs, so they're a step above us in that respect. They're more a self-contained unit. We require or really lean on our clinical partners like the local health districts and help the clinics to take our positive client further in the treatment process. I know that the Kirby Institute and the University of New South Wales are looking at what POWER has done. We did clinics up as far as Kempsey and Newcastle, Port Macquarie, Taree, and we took the bus up there. From that, they're doing a paper at the moment, I saw, and to try and work out better ways to take all the positives of peer-led buses and putting them out to community. We arrive somewhere and we've got the car and 2 marked tarpaulins and 10 tables and 3 staff and banners, and it looks like the circus has come to town, and that suits, but it's an expense. You know what I mean? Like, for all 3 of us to go and do all that, it's quite a big expense to do it.
Yeah.
So we've got to try and find more economical ways of doing that, and we need to set up stuff that people in regional New South Wales, for instance, do get the same access to treatment and testing and treatment as someone who lives next door to St Vincent's would. Because they're entitled to it. I mean, they are entitled to it.
They are.
Yeah. So that's the sort of stuff that people in the background are doing, like the University of New South Wales, and to try and get better results for people.
And that's just very quickly, how does that work in Queensland? Because you've got such a big state. How are you able to access the rural and remote communities?
Oh, that's a really good question. I've been asking for a helicopter. So from every conference I go to, I ask for a helicopter so we can reach, the rural, community. But for ourselves, we've been doing Quinn's been like flying, say, to Rockhampton, then driving like 2 hours inland to some communities where there's a need for us to be there and doing, like constantly going there, testing people, having conversations, taking equipment out, taking water out because they can't, use the water. So just like building that rapport with these communities, which is great. Like, I loved going out there. I wish we could continue doing it, but it's all got to do with funding. So this time we're going to be driving inland. We're doing a road trip to educate people and hopefully do some testing as well on a road trip. Don't know if my co-worker or the co-worker is going to put up with me in 4 days in the car, but that's why we need a helicopter. So whatever we can do just to make it easy for our community and try and make it fair so we can test everyone and treat them.
Richard, can I just make one more point? Newer offers
Sure.
a service to residents of New South Wales, which is our postal service. So it's not necessarily the Hep C treatment and testing part of this business, but it's certainly prevention. So anyone living in New South Wales can contact the postal service at Newer and get stuff sent out to them. So we're talking the equipment being sent out. We also have peer distributors we've established around the state, which are doing the same for equipment. It's all about reducing the exposure of reusing infected equipment. So some initiatives like that are happening and are quite exciting and whatever else. But every state is doing stuff differently. So I mean, maybe a more national approach so that everybody has peer distributors.
Everyone gets that.
Everyone has a helicopter like Isha wants.
Hey, we're first, mate. I've been asking to do this helicopter for 8 years. I don't know if we'll get it, but maybe.
Fight you for that one. I want a blue one.
Thank you, everyone, for joining us. Just to remind everybody that the recording of this will be available through the AIVL website and YouTube. Thank you so much to the most fantastic panelists we've had. It's been a pleasure having you all here. And please say goodbye, everyone. Thank you.
Thank you.
Good
Bye-bye.
afternoon. Bye.
Thanks, everyone.
Bye.
Bye.
Bye.